Hello everyone. Today we begins with the immunity part 1. Immunity is the ability to resist the organisms or toxins which can damage the tissue or organs. So immunity simply means ability to resist organisms or toxins which can going to damage tissue or organs. Immunity refers to the resistance of the body to pathogens and their toxic products. So that is the proper definition of the immunity. Immunity which refers to resistance of the body to pathogens and their toxic products. Immunities are of two types, innate immunity and acquired immunity. Innate immunity means the immunity which presents since birth, and acquired immunity means whatever the immunity developing inside our body after the birth. Antigens, substance that can stimulate immune response. The substance means it's anything, either a foreign material or bacteria, virus, etc. Antibodies, these are the gamma globulins which produce in response to antigenic stimulation. Whenever some type of antigen enter inside our body, it going to stimulate the immune response, and in response to this antigen our bodies releases certain type of antibodies. These antibody released from the plasma cells. So these are the gamma globulins produced in response to antigenic stimulation. Immune response, these are the humoral and cell mediated. B lymphocytes works as the function of humoral immunity, where the T lymphocyte works for the cell mediated immunity. So here this is the immune response and this is the types of immunity. Types of immunity are of two types, innate immunity and acquired immunity, where the immune response is also the two types, humoral immune response and cell mediated immune response. We will see this immune response in the part 2 of the immunity. As you had seen in the previous slide, that immunity broadly classified as the innate immunity and acquired immunity. Innate immunity means the immunity which presents or resistance of our body to different type of foreign materials which present since birth, and acquired means whatever the immunity generated or developing inside our human body after the birth. So that is the acquired immunity. Now the acquired immunity again of two types, active and passive. And active immunity, active acquired immunity again of two types, humoral and cell mediated. We will see step by step what is active, what is passive, humoral and cell mediated immunity. Innate immune system, the immunity since birth, that means inborn immunity. These are the non-specific, which is also known as dumb bombs. Acquired or adaptive immune system, which formed after the attack by organisms, highly specific against viruses, bacteria, toxins, foreign body, and these are known as smart bombs. So innate immune system are the dumb bombs, and these acquired immune system are the smart bombs. I explain what is dumb bombs and smart bombs in an easy way. I hope everyone played the game PUBG. Alright, for example, that's you having a weapon inside your hand. That's the building having 2 floors. This is the window. For example, your enemy is standing over here. Alright, he is also having the weapon. Now first of all, just remember that you don't have any scopes, either 2x, 4x or 8x. Now without scopes you are blindly shooting your enemies like this. So these are the dumb bombs. because you don't know where your bullets are going to hit, either it going to hit in the wall or hit your enemy. But the next situation, if you have 8x scope and now you are going to hit your enemy with the headshot, all right. So these are the smart bombs. I hope you understood in easy way. Without scope, whenever you try to target your enemy, these are the dumb bombs. You don't know where your bullets are going to hit, either in the wall or in the enemy or in the head or body of the enemy or anything or anywhere. But with the scope, for example, if you have 8x scope, then one or two bullet is enough to give the headshot to the enemy. So these are the smart bombs. Immune system consists of immunological cells distributed in two main compartments. Mononuclear phagocytic system, which is also known as tissue macrophage system, and second one is the lymphoid component. First of all, tissue macrophage system. Just remember which cell are known as macrophages. Whenever the monocyte circulating inside the blood vessel, the cell is known as monocyte. But when the monocyte coming out of the blood vessel and present inside the different type of tissue, then these are known as macrophages. So inside the liver, this is known as Kupffer cells, spleen, bone marrow, lymph node, lungs, connective tissue. These are the histiocytes, pleura and peritoneum, subcutaneous tissue, bones, osteoclasts, CNS, microglial cells. So these all cells function as tissue macrophage system. Now the second one is the lymphoid system. Lymphoid system either central or primary or peripheral. The central system, which includes the thymus gland, and second one is the bone marrow or fetal liver or bursa fabriceus. And the peripheral system includes the lymph nodes, spleen, mucosa associated lymphoid tissue. So this lymphoid system divided into two parts, central or primary and peripheral. This central part includes the thymus, bone marrow or fetal liver, bursa fabriceus, and the peripheral part includes the lymph nodes, spleen, mucosa associated lymphoid tissue. Now this is the red bone marrow, where all the stem cells or pluripotent hemopoietic stem cell are there, and step by step different type of blood cell formation takes place. I told you in the chapter of WBC that all the lymphocyte first or in the initial phase are present in the bone marrow. But the cells which migrate from the bone marrow into the thymus and where the maturation process takes place inside the thymus, these cells are known as T lymphocyte, T for thymus. And which cells still present inside the bone marrow and where the maturation of the lymphocyte takes place inside the bone marrow. So these cells are known as B lymphocyte, B for bone marrow, or bursa fabriceus or bursa processing. So these are the B lymphocyte. So these are the functional divisions of the lymphocyte. These are the T lymphocyte and these are the B lymphocyte. T lymphocyte works for the cell mediated immunity, where the B lymphocyte works for the humoral immunity. B lymphocyte gives rise to the plasma cells, and these plasma cells releases different type of immunoglobulins or antibodies. All right. So immunity, two types, innate immunity and acquired immunity. Innate immunity is the non-specific, and if we are going to find the specific innate immunity, then it will be the species specific, racial specific and individual specific innate immunity. And acquired immunity is of two types, active immunity and passive immunity, or simply active acquired immunity and passive acquired immunity. Both of the active as well as passive acquired immunity again having the two types, natural or artificial. So in that way we are going to say that natural active acquired immunity or artificial active acquired immunity. Now the next one is the natural passive acquired immunity and artificial passive acquired immunity. Alright. First of all, innate immunity. The immunity which presents since birth or inborn immunity. Mechanical barriers, skin and mucosa. Surface secretions, sebaceous glands, saliva, gastric juice and tears. Humoral, lysosomes, basic polypeptides, complement, interferons, etc. Cellular, phagocytes, natural killer cell, eosinophils. So these all are present since birth. So this immunity is known as innate immunity. Now the inflammation, role of neutrophils and monocytes. Inflammation means a tissue changes after the tissue injury. When there is an injury to the tissue, then there will be the certain amount of changes takes place inside that specific tissue. Characteristics: vasodilatation of local blood vessels, increased capillary permeability, clotting of interstitial fluid, migration of granulocytes and monocytes, phagocytosis process takes place, swelling of tissue cells. So these are the characteristic of the inflammation. Mechanism: the release of histamine, bradykinin, 5-hydroxytryptamine, prostaglandins, cytokines, etc. Whenever there is a release of this histamine, bradykinin, 5-hydroxytryptamine, prostaglandin, cytokines, these all causes this type of events, and this type of events are the characteristic of inflammation. So I already covered this. First line of defense is the tissue macrophage. Second line of defense, invasion by the neutrophils. Third line of defense, invasion of monocyte to form macrophages. Fourth line of defense, increased production of neutrophils and monocytes. So these are the defense mechanism which works inside our body. So now the second one is the acquired immunity. Acquired immunity is of two types, active and passive. So this is the active acquired immunity and this is the passive acquired immunity. Alright. Now again both this active and passive immunity divided into natural and artificial immunity. So first of all, natural active acquired immunity. So whenever some type of antigens enter inside our body, and whenever this type of antigens going to stimulate our immune response, and whatever the immunity is generated against that specific antigen, that type of immunity is known as natural active acquired immunity. Now the second one is the artificial active acquired immunity. Artificial active acquired immunity. I hope everyone knows about the vaccine. So this provide artificial active acquired immunity. Now on the second hand, there is the passive acquired immunity. Passive acquired immunity again of natural and artificial. So first of all, natural passive acquired immunity. Whatever the immunity which is given from mother to her baby, this covers or this known as natural passive acquired immunity. And the second one is the artificial passive acquired immunity, means whenever we are giving directly synthesized serum which having the different types of immunoglobulins and all the types of immune materials are there, then this type of immunity is known as artificial passive acquired immunity. Mostly this type of serum we have to given to the immunodeficient individuals. For example, the patient who are suffering from AIDS or HIV virus infection. Now the differences between the active immunity and passive immunity. First point, active immunity. Antibody production by our own immune system. Passive immunity, received passively. Second one, negative phase is present, not present. And next one is the latent period, 4 days to 4 weeks. Alright, and in the passive immunity, there is no latent period. So let me explain about the negative phase as well as latent period. I mean, what is negative phase and what is latent period. So I am just drawing you a simple graph where at this point, for example, the bacterial infection takes place. I think whenever the bacterial infection takes place, for example, these days we consider as 0. Alright. Now at this point, immunity is generated inside our body. Clear? For example, after the 5 days, inside our body, the immunity is generated to that specific virus or bacteria. Now this 0 to 5 days, there is no any type of immunity is present to that specific bacteria inside our body. That means absence of immunity during this 0 to 5 days inside our body to that specific bacteria. So this phase is known as negative phase, without any type of immunity. Now the latent period. So latent period is 4 days to 4 weeks. So just come back to our example. Our body needs 0 to 5 days to set up immunity against that specific bacteria. So this time duration is known as latent period. And during this latent period, there is no immunity is present for that specific bacteria inside our body, and that is known as negative phase. So in the active immunity, where our own immune system produces different type of antibodies, so in that condition, negative phase is present as well as latent period is 4 days to 4 weeks. But in the passive immunity, where we are receiving passively immunity directly from some other sources, so they were in that condition, there isn't any presence of negative phase as well as no latent period. Now the 4th point, secondary response more enhanced. So this is the first phase. For example, first time this bacteria attack, and whatever the immunity is generated, that is the first response. Now when the second time the same bacteria attack inside our body, so immediately there will be the presence of memory cells inside our blood that immediately responds to that bacteria and kill them directly. So this response is known as secondary response. And on the passive immunity, no immunological memory, so no effect. Active immunity duration is long lasting, where the passive immunity duration is short lasting. Active immunity, it is more effective because it's our own immune system which produces the immune response. But in the passive immunity, it is less effective because the person receiving immunity passively. And active immunity, it is not applicable in immunodeficient individual, but passive immunity, it is applicable in immunodeficient individual. For example, the patients of HIV virus infection. So via this presentation, I just gave you some basic idea about the immunity as well as different types of immunity, innate immunity or acquired immunity. Acquired immunity, again active and passive, and both the again having a natural as well as artificial immunity. So these are the types of the immunity I already covered in this part number 1 of this immunity. On the next part, I am going to cover the immune response, cellular immune response as well as humoral immune response. Cellular immune response is the function of T lymphocyte, where the humoral immune response is the function of B lymphocyte. We will see on the part 2 of the immunity.